As the World Health Organization (WHO) member countries mark the 16th World Malaria Day, Nigeria, a country that has been curtailing the menacing impact of the parasite transmitted by female anopheles mosquitoes, is not least among countries observing the day. According to official data, malaria, which is widely regarded as a familiar foe of public health, killed at least 619,000 people in 2021, with 96% of those deceased coming from Africa. In spite of the astronomical number in 2021, the number of cases of malaria actually reduced as compared to 2020. In its renewed drive to eradicate the parasite, WHO, through collaboration with partners, embarked on seasonal malaria preventive treatment, reaching 45 million children in 15 African countries in 2021, an improvement on the 33.4 million recorded in 2020.
Vaccine and supplies.
Addressing journalists in Abuja, WHO country representative to Nigeria, Dr. Walter Mulumbu, underscored the importance of administering malaria vaccine to vulnerable children while calling for a more efficient supply chain.
It's critically important to deliver the malaria vaccine to children at risk. WHO, Gavi, UNICEF, and other partners are working together to increase supply as rapidly as possible to protect more vulnerable children and save more lives. Indeed, the biggest challenge with the malaria vaccine, the RTC vaccine, is supply chain, and we don't have enough supply to give to all the countries that need them. So it will need some strategic allocation, something we've been used to with the COVID-19 vaccination.
Alex, Deputy WR, and
Dr. Mulombo also said that 8 African countries are on course to meet the global technical strategy target. He stressed that joining that list would be a good feather on Nigeria's cap.
Overall, in terms of reduction in malaria incidence, 8 countries are on track to meet the 2025 Global Technical Strategy target. These are Cabo Verde, Ethiopia, the Gambia, Ghana, Mauritania, Rwanda, South Africa, and Zimbabwe. And it's my wish to add the 9th country that will be called Nigeria very soon, hopefully. But 15 countries achieved insufficient reduction while 20 have witnessed stagnation or increase in cases. 10 countries saw increases in malaria death. The pace of progress must be accelerated if we want to achieve the set target for 2025 and 2030.
The country representative charged Nigeria's government to show political will in the acceleration of efforts to combat malaria and save lives. He also provided clarification on the contentious issues surrounding the RTSS malaria vaccine.
World Malaria Day gives us an opportunity to renew political commitment and bolster investment in malaria prevention, control, and elimination. Therefore, I call on Nigerian government, like other member states, to redouble their commitment to implement an ambitious and innovative acceleration plan to rapidly reduce the burden of malaria and save lives and the population. This can be done by ensuring that everyone, everywhere, has access to the quality and affordable malaria services they need. This will require a more granular understanding of who is missing out, why they are vulnerable, and what are the barriers to accessing malaria preventive and treatment services. In this RD speech, I mentioned RTSS malaria vaccine. This is not the one we are talking about, the one that NAFDA gave provisional approval. And this is also in a way understandable, because to get full approval, you need approval from WHO. And that particular vaccine is still being studied. WHO does not have the full complement of data and information to enable it to, to endorse it or recommend it for use. And you've seen the same process during the COVID-19. when we start seeing a new vaccine coming up, there was a dossier that went to WHO with a group of experts to review the evidence before recommending. So that we are at that stage um, of getting full complement of information. And I believe when we get that level, any country which willing to introduce a new additional malaria vaccine will be free to do so.
At least 1.6 billion malaria cases have been recorded between 2000 and 2021, with over 11 million malaria-related deaths registered in the WHO African region. In Abuja, Nigeria's capital, Abiodun Mohammed, Top Accolade News.